what is minimally invasive spine surgery?
It's a good question. I feel like it's a term that's thrown around a lot. It's almost become a marketing term such that it loses some of its meaning. In my opinion, there's really two parts of it. The first part of it is a philosophical thing, which is really trying to do the least you possibly can in order to address the patient's problems. And that least you can often means no surgery at all. And
Oh, wow.
I say this over and over in my clinic to my patients, the least invasive surgery is no surgery. And so really trying to help them avoid surgery if at all possible is a big part of it. And then if they're going to need surgery, selecting the smallest possible thing that you can do to give them a good chance of relief. So that's really...
I did not expect that from a spine surgeon.
Yeah. That's really the philosophy part of it. And we can go into detail about things we can do to help avoid or prevent surgery.
Yes.
But certainly exhausting those things whenever possible, whenever feasible.
Okay.
And then from a surgical perspective, the key to minimally invasive is really not just small incisions, although I take pride in making really tiny incisions. That's just kind of my thing. But really protecting and preserving the soft tissues under the spine.
Okay.
And so I think people lose sight of the fact that there's all these muscles and tendons and ligaments that are helping support their spine. It's not just the bones and the discs. And the key to minimally invasive is never cutting or damaging those muscles, which is something that does commonly occur in traditional spine surgery.
Very good point. Listeners, welcome back to our brand new season 7 of Doc Talk Live. Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on medical experts to answer commonly asked questions. Be sure to send in your questions through Facebook Live every Wednesday at 5 p.m. You can find more information about the show on our Facebook, Instagram, Twitter, YouTube, and our website, Doc Talk Live. That's DOCTALK live.com. Also, watch more episodes of the show on platforms such as Spotify, iTunes, and iHeartRadio. My name is Dr. Sylvie Simon, and as always, it is a pleasure to be back here in the studio with you guys, and I am the host of today's show. Joining us today, we have Dr. Peter Derman, and he will be educating us and discussing the topic of minimally invasive spine surgery. Dr. Derman will talk to us about what exactly is minimally invasive spinal surgery and who is a candidate for surgery and so much more. So Dr. Derman, welcome to Doc Talk Live. Thank you very much for being here and volunteering your time. Tell us about you and your practice.
Thanks for having me. I'm excited to be here. Peter Derman. I'm a spine surgeon, as you mentioned. I practice with the Texas Back Institute, which is a large spine-specific group here in the Dallas-Fort Worth Metroplex. We have about a dozen offices and 24 or so spine specialists. I specialize in minimally invasive endoscopic spine surgery, basically. So seeing patients all over Dallas, Plano, Frisco is really kind of the corridor at which I see patients. But, fortunately, patients are willing to travel for good spine care. So I often see people remotely via telemed from around the country.
Yeah, and what I've heard from my patients, that is important to do so. Find a good spine surgeon. But Dr. Derman is going to explain that a little more. And please, let's start off by just saying explain to us what is minimally invasive spine surgery?
It's a good question. I feel like it's a term that's thrown around a lot. It's almost become a marketing term such that it loses some of its meaning. In my opinion, there's really two parts of it. The first part of it is a philosophical thing, which is really trying to do the least you possibly can in order to address the patient's problems. And that least you can often means no surgery at all. And
Oh, wow.
I say this over and over in my clinic to my patients, the least invasive surgery is no surgery. And so really trying to help them avoid surgery if at all possible is a big part of it. And then if they're going to need surgery, selecting the smallest possible thing that you can do to give them a good chance of relief. So that's really...
I did not expect that from a spine surgeon. But
yeah. That's really the philosophy part of it. And we can go into detail about things we can do to help avoid or prevent surgery.
Yes.
But certainly exhausting those things whenever possible, whenever, feasible.
Okay.
And then from a surgical perspective, the key to minimally invasive is really not just small incisions, although I take pride in making really tiny incisions. That's just kind of my thing. But really protecting and preserving the soft tissues under the spine.
Okay.
And so I think people lose sight of the fact that there's all these muscles and tendons and ligaments that are helping support their spine. It's not just the bones and the discs. And the key to minimally invasive is never cutting or damaging those muscles, which is something that does commonly occur in traditional spine surgery.
Very good point. So who will be candidates for this type of procedure or surgery?
Yeah, so there's a variety of different minimally invasive techniques, really for almost any type of spine surgery. So whether it's a neck problem or a back problem or sciatica or really any of those things, there are minimally invasive options that tend to exist. So it really becomes a question of who is a candidate for spine surgery. And that's typically patients who have nerve compression, and that manifests as typically sciatica, so pain shooting down the arms or the legs or heaviness in the legs when they walk. Back pain and neck pain is often something that people have, but is actually frequently treated without surgery. So it's really patients who have pinched nerves who are usually the most common candidates for spine surgery. And typically we can find a good minimally invasive option for those people.
And these people, do they have to go through some sort of physical therapy or some sort of alternative, therapy before they come to you? Or do you guys have that in your program, or how does it work?
Yeah, good question. We're kind of like an all-encompassing spine experience, I guess. I guess you don't want to need us, but we're here if you do. And so we have everything from, conservative care doctors, interventional pain doctors, physical therapy, and we'll kind of work you through the whole process. Many people never end up getting to the surgical, side of things.
Wow.
And that's the goal. I'm really proud of the fact that about 90% of my patients don't end up having surgery.
That is impressive.
Yeah.
That is actually an amazing number. 90% comes to a spine surgeon and they don't get surgery.
And they don't get surgery.
But they're well.
But they get better. That's right.
That's amazing.
And so it's really maximizing physical therapy, sometimes, anti-inflammatory type medications if they can take those, different kind of medications, and injections are also a good option.
Okay.
And only if all else fails do we start thinking about surgery, and then what's the smallest surgery we can do to give a good chance of relief.
Dr. German, you had also mentioned something about an endoscopic
Yeah.
spine surgery. What is that about?
Yeah, that's something I'm particularly excited about.
Okay.
So, in the spectrum of minimally invasive, basically incisions have gotten smaller and smaller, but the underlying surgery still involves, peering down with your eyes or a microscope or something into the patient's spine, which requires making at least some opening to see the spine from the outside world. Endoscopic surgery is really it's being called ultra minimally invasive now, and it's like the next, a real next generation paradigm shift. And what I liken it to is just like if in the past when you had a shoulder problem or a knee problem, back in the day they used to open up your shoulder and clean some stuff out and then sew it back up. Now you go to the doctor and they do a scope, right? They put a camera in and they can clean out and you go home right afterwards. Well, you can do that with the spine too.
Wow.
And so that's what endoscopic spine surgery is. So the incision is less than a centimeter, and I'm able to place a camera all the way down to the level of the spine, and I watch the whole thing on a big high definition monitor, and which means that I don't even have to open, the spine to the outside world, and I'm able to, take pressure off the nerves and address all kinds of different spine problems.
That is impressive. And a lot of my patients come in for different types of spinal surgeries, but a more common one is spinal fusion.
Yeah.
And they have fusions of their lumbar or vertebrae. Can you explain to us what that is like, and is that really a minimally invasive procedure?
Yeah, so spine fusion means basically welding two bones together of the spine. And so the spine is made up of a whole bunch of bones, and then there's discs and joints in between that allow you to move. And there's certain situations where a fusion is necessary.
Okay.
That is like if you're in, say, a car accident and there's instability, right? Or some people just develop instability, like their bones are sliding around. And so they need the support and the stability, and that's what a fusion can do. Or if people have a big scoliosis orthosis and curvature, and they need to be straightened. However, there's a lot of spine problems that don't need a spine fusion, and I really try to avoid fusion if at all possible.
Oh, okay.
The downside of fusion is that, one, it's typically more surgery. It's a little bit more of a recovery, even though there are minimally invasive ways of doing it. And then the real concern is if you fuse a lot of levels, you start to lose motion, which you don't want. My goal is always to preserve motion. And then, long term, the concern is you can have acceleration of wear and tear of the levels above and below a fusion. Because if you imagine, if you stop motion somewhere, you're going to make up for it elsewhere, and then you can have wear and tear above and below. So, certain instances, fusion is necessary.
Sure.
Minimally invasive means can be used for that, but even so, I try to avoid that whenever I can.
Good deal. And can you explain to us, because when we think of spine surgery, right, it's just a huge deal. I mean, you're in bed for days, but what is the recovery like for minimally invasive spinal surgery?
Yeah, certainly not in bed for days. So, the vast majority, there is a spectrum, right? So, patients who need a more extensive surgery versus, a smaller surgery. But what I'll say is, about 80% of my patients are home within a few hours of surgery.
Wow.
No back brace, no neck brace, up walking around and going back to their activities. Especially my endoscopic patients, and this, it continues to blow my mind that, I do my endoscopic cases on Thursdays, and almost everyone is back at work on Monday.
Oh, that's impressive.
So a lot different, and, most of my patients just take Tylenol or some over-the-counter pain medicine afterwards. A lot of people take no pain medication at all. And so it's really a departure from these traditional spine surgeries where, you could be in the hospital for a week. You could have to go to rehab afterwards, etc. I'd say 80% of my patients are probably home same day. Probably 95% are home within 24 hours.
Yes, and Dr. Derman knows he's talking to a kidney doctor. He mentioned Tylenol. I'm just going to put it out there. Of course, we all love NSAIDs, right? And they are great anti-inflammatory meds. I use them. But I just want to throw it out there. Just be careful with your kidney function if you are taking a lot of anti-inflammatory drugs. I just want to put it out there.
No, I totally agree, and I'm very cautious about that.
Thank you very much. Since you're talking about new therapies, breaking edge technology, how about stem cells in spinal surgery or, spinal diseases?
Yeah, so it's a question I get asked every day. In fact, I did a telemedicine appointment with a guy from Florida today who was asking me if he should do stem cells. I think that the future of medicine is... A future of spine surgery is, as I mentioned, less fusions, more motion preservation. So that means either disc replacement, which we can talk about, or just doing clean-out surgeries without having to do a fusion. And so that's one thing. And then regenerative stuff, right? So dealing with problems before they're big problems, trying to get the body to heal itself. And I think that the allure of stem cells is that they're cells that can potentially develop into anything, regenerate tissues, and maybe reverse what so far has been kind of a one-way street of aging. Right. The issue right now is that it's still a relatively young field. I would say a very young field. And so there's still a lot of research and development that needs to happen with stem cells. Yeah. I think there's promise there, but there's a lot of variability in the treatments, and we don't know a ton about the outcomes yet. And it's so, it's not FDA approved yet, which means it's not covered by insurance. And so what I tell people is, hey, it's relatively unlikely to be harmful to you. There's probably some promise there, but you're likely going to have to pay out of pocket for it. Gotcha. And so I would seek out one of the centers that has a lot of experience in the United States with it, and really do your research about it before you plunk down, $10,000 for it.
Thank you. And actually, you mentioned insurance. So these minimally invasive procedures and endoscopic spinal surgeries, they're covered by insurance?
They are. So, they are, the typical type spine surgery. They're just done with less invasive techniques. And so, the surgeries that I do are all covered by, the standard insurance, like they would a traditional spine surgery. Okay. It's just the patient gets to go home.
Wow. And these are all done as day procedures?
Yeah, the vast majority.
Okay. And, You in the beginning of the conversation, you had mentioned, some prevention, and it looks like your practice focuses a lot not just on the surgery, but everything kind of around the surgery, prevent it. But prevention is always the best cure in a lot of things, right? So, what are some important measures that they can take from these, or what are, let's say, common day-to-day injuries, or some measures they can take to prevent those?
Yeah, very good question. So, the let me take a step back. Core strengthening is key. That's what I should
Oh,
say.
we've
So
heard that
for
before.
low back problems,
Yes.
keeping a strong core, maintaining a healthy weight, those are the things that we should all be working to maintain and achieve. The spine is just a mechanical structure, right? So the more weight that's pulling down, the more stress the discs have on them and the joints, and the less strength the core has, the less able the soft tissues are to help alleviate and take the pressure off. So, keeping a strong core, I often encourage people to do Pilates or yoga, or, even planks are just a great exercise to do that anyone can do at home without, needing any sort of equipment or anything. Planks, side planks, bridges, stuff like that. So that's a great preventative. Obviously, having good mechanics when you lift heavy objects, lift with your legs, not with your back.
Yes.
And then if you develop problems, physical therapy or chiropractic care, those kind of therapeutic exercises can be very beneficial and is often where I start.
Okay.
So that helps patients with their mobility, with strengthening their core. One of the problems as we get older, you start to get arthritis and you stiffen up basically.
Yeah.
And it becomes this vicious cycle. So you're stiff, so you don't move because it hurts.
Yes.
And then you get stiffer because you're not moving. And therapy and exercises can help get you out of that. And if that doesn't work, and we talked about anti-inflammatories or Tylenol, there's different kind of medications. Yes. I'm not a big medication fan. Okay. But if there's something that you can take temporarily to help you get through an episode, then there's relatively little issue with that. And then injections can be helpful too. Okay. So if patients fail medications and physical therapy type stuff, that's when injections can be good, and those can give people long-term relief in some instances. And if that fails, then we start thinking about surgery if they have a problem that's amenable to surgery.
And first of all, the injections, what is actually in these injections?
Yeah.
What are we injecting?
There's different kinds, and they help with different problems. The common ones that people tend to know about are epidural steroid injections, and those are steroid injections. And the rationale for that is steroids are strong anti-inflammatories. Yeah. And so by injecting them in a very targeted, very focal location, you can actually use pretty low doses, so there's not problems. There doesn't tend to be problems with the rest of the body as opposed to like oral steroids, which are high doses and can have kidney problems and all kinds of other problems.
Actually, kidney doctors are okay with the
with the steroids.
Those steroids are okay.
That's true. But other kind of doctors might not like them as much.
Yes, exactly.
But these steroids are injected very focally, so it's a low dose directed, and it can bring down irritation of nerves and alleviate sciatica and nerve compression type things. The other kind of injections target the little joints in the back, and that's more for back or neck pain, and those are called facet injections or medial branch blocks or rhizotomies. And those are kind of the go-to things for people who have primarily what we call axial pain up and down the center of the spine rather than pain shooting down the arms or the legs.
Oh, I gotcha. And, I'm going to ask a question on behalf of one of my patients I saw in clinic, of course, with back pain, and she had injections, and perfect, out of the clinic, she was okay, and then, about 24 hours later, it comes back. Is there any predicting on who's going to have more relief on injection versus not so much?
Yeah, it's tough. There's a lot of variability there, and it's difficult to predict. Some people are just not a great injection candidate. Yeah. People who have severe compression and weakness and spinal cord injury, then clearly like an injection isn't for them. Yeah. But for the other people, what I say is there's relatively little downside to injection, and it's worth a try, right? Yep. Especially if the other option is either surgery or live with it. Yeah. It's often worth a try. And just because one injection doesn't work, there's different kinds of injections as we talked about. And sometimes it's a little bit of trial and error to figure out the perfect thing for them.
Thank you, Dr. Derman. So what do you think the future changes, or what future changes do you anticipate in this, spinal surgery world?
Yeah, I think that it's going to be less invasive surgery, minimally
Yeah.
invasive surgery, endoscopic surgery, as you can tell I'm passionate about.
Yes.
Less fusion type surgery, as our ability to address spine issues without needing to weld the bones together. These minimally invasive techniques allow us to take the pressure off the nerves without doing all this collateral damage, and in many cases allows me to address a problem without a fusion.
Yeah.
And so I think that's great for both the short and the long term of patients. And then the other part of things is disc replacement, as I alluded to. And so
Gotcha.
in some instances where you need to remove the
Yeah.
disc, you can replace it rather than with something that doesn't move, a fusion, and locks them in place with something that does move. It's almost like a little knee replacement, and it's got metal and fancy plastic bearing that maintains their motion and doesn't have the problems, as much of the problems with having issues above and below. So
Wow.
I think it's addressing spine issues but maintaining motion and maintaining function.
Gotcha. And I had a question just now, but even with, so what are some examples of surgeries where it used to be open and now you can do minimally invasive?
Yeah, so for instance, a laminectomy is
Okay.
a common, or a microdiscectomy.
Yeah.
Those are surgeries where there's pressure on the nerves, typically in the
Yes.
low back.
Uh-huh.
And the way they used to be, and I say used to be, still are largely done, but the traditional way of doing them is an incision down the center of the back, and then literally burning or stripping the muscles off the spine,
Oh,
just
boy.
to see the spine. And the thought of that, you seemed repulsed by that,
Yeah.
and so am I. I would feel like an accomplice to a crime doing all the damage to those very important
Yes.
structures. And then, once that's done, they can then go about taking the pressure off the spine, which oftentimes involves removing, bone and some of the joint,
Yes.
etc. And so, the key to doing that minimally invasively is, I do those through a little tiny incision.
That makes a lot of sense, because I have, again, we see a lot of patients, so they say, after back surgery, my back's kind of worse.
Yeah.
So that makes your graphic description
Yeah.
makes a lot of sense.
And I hear it all the time, I
Yeah.
tell people like, hey, I think you've tried all these things. I think you could benefit from spine surgery. And they're horrified.
Yeah.
I can see the panic in their eyes. Like,
Right.
my neighbor said, never, ever have spine surgery. I did it,
Right.
and now my back hurts
Those
worse.
same words I've heard a lot.
And that's because they were basically filleted open. And
So what is the response you get? I mean, share some, I guess, success stories, or
Yeah.
I mean, not sharing any names, but
For sure. For instance, I saw a patient today who
Yeah.
he came back in for his 2-week appointment after surgery.
Mhm.
He's in his 60s or so. He had a big disc herniation in his low back. The disc was bulging out and was severely crushing his nerves. And he was in a wheelchair when I met him. I did a little hour and a half surgery or so. He was up walking around and home, and I
my
saw
goodness.
him back today. He's taking no pain medication, has zero pain, no back pain, no leg pain.
Wow.
He's up walking around. He's a normal guy. He brought me bundt cakes. I love him. And so, from a selfish perspective, I
Yeah.
love these surgeries because I'm just a simple guy. I like high fives and instant gratification.
Yeah.
And it's all the upside of traditional spine surgery without the downside associated with
Yeah.
getting to the spine and doing all that damage. So
That is awesome, and great job, Dr. Durman. I'm going to ask you a question that I was asking you earlier. I'm just going to repeat my question, but who do you want working on your spine? I mean, there's neurosurgeons, there's orthopedic doctors, so if you can explain to our audience who to go to.
yeah, it's
Other than you, of course.
yeah, only me. No, it's a common question. What you want is a spine surgeon. That's the key. So you can get to spine surgery via different routes. Really 2 routes. One is through orthopedics and one is through neurosurgery. There used to be a big divide. They were siloed, where the orthopedists would do the fusions and the neurosurgeons would do the decompressions or taking the pressure
Yeah.
off the nerves. That's really a thing of the past, and the difference between the two is really negligible at this point. And so what you really want is somebody who specializes only in spine, not an orthopedic surgeon who does knees and hips and an occasional spine, and not a neurosurgeon who does mostly brain work and then an occasional spine, but really somebody who focuses just on that. And the training has actually really converged.
Okay.
So like if somebody watched me operate, they wouldn't really be able to tell where my training came from, because I was trained by both neurosurgeons and orthopedic surgeons, and I took kind of what I think is the best of both worlds.
Got it. Oh my goodness, guys, that was so interesting, Dr. Derman. Thank you. But we are actually approaching the end of our show. And so you have tuned in to Doc Talk Live. Remember to check us out on our Facebook, Instagram, Twitter, and our website, doctalklive.com. So you can obtain more information about next week's hot topic and guests. Also, don't forget to like us on Facebook, Instagram, Twitter, and to subscribe to our YouTube channel. You can now listen on our podcast as well on Spotify and Stitcher. Be sure to send in your questions on our social media platforms to get them answered by our experts. Dr. Derman, any last-minute information you would like to share with our listeners? And please tell us about where to find you.
For sure. Well, I appreciate you having me on, and hopefully what listeners have gleaned is it's not scary to come and see me. I'm not one to jump to surgery. It's really a last resort, and that's how it should be. I would encourage them, if anyone's ever told them or tells them that they should have spine surgery, that it's worth getting a second opinion. Just because you just want to, do your research and make sure you're getting the least invasive, most conservative treatment for your problem. So I'm always happy to see anybody. Patients can find me. Our website is texasback.com. I'm also on all the social media too, so Facebook, Instagram. If you just put Peter Derman, MD, it's Derman is my last name. They'll be able to check me out there. And I've posted a lot of videos giving more detail about the procedures that we talked about, and examples of patients and videos of them kind of getting back to their lives.
And that was to say the company again?
TexasBack, BACK.com. So
TexasBack.com.
Texas Back Institute, that's our practice, and the website's TexasBack.com.
And thank you, Dr. Peter Derman, for being with us, volunteering your time. It was a pleasure having you. And that's the end of this show, folks. Stay healthy. We'll see you next week.